My goodness, that's a lot of work. Um, so that's interesting. The college right now is becoming much more involved in what they're calling global medicine, and so there's a committee and a group that's really focused on encouraging new graduates to take on a role not unlike what you've just described. Plus, there's also that interest in dealing with immigrant populations here and refugee populations here as well. So that's been that's a fairly new initiative within the college. I One of the things I wanted to ask you about a little bit was how you look on the discipline of family medicine. This new involvement in global health here is part of a special interest focused practice initiative within the college. So, it's trying to provide a home for physicians who take on a special interest or a focus in their practice. It might be sports medicine, but it also might be what you've just described doing. I'm curious about how you look at family medicine, whether you see this as a positive direction or not. I've had everybody sort of talk about their definition of generalism and so forth. Do you have any comments in that regard?
Well, yes, I guess it sounds like there's sort of two topics there. First, the way family medicine has been going. Um, well, the way I look at it, the way I've practiced family medicine and really enjoyed it and would do it again the same way, that seems to be changing. Now, everything in life changes, nothing stays the same, everything, that's just the way nature is. But I guess, Frank, I'm just a little bit disappointed maybe in the way family medicine is gone, and I think we're getting too many subspecialists within family medicine and not enough people actually treating the whole family from birth until death, which to me is what family medicine is all about. And if you don't really become involved in that very much, then are you really a family physician? And I guess that has sort of changed. Working in walk-in clinics now, I see a lot of patients coming in um, because it's difficult to get in to see their family physician, or the family doctor doesn't do this or doesn't do that. And if they'd have come in 25 years ago and said that to me, I would have disappointed. I would have been disappointed. I would have wanted to try to do or help them in every way that they asked, rather than have them go to a walk-in clinic looking for somebody else. I think family physicians have lost a bit of that, and patients don't look on their family doctor quite the same way as they used to. I think really, if we're going to succeed as a college of family medicine, I think we need to get back a bit more towards that. Um, or if not, then I think things will evolve and change, and we will be a different college with a different name doing different things, and not really family medicine. To be to Again, when you go abroad to do work, depends on what you want to do. I know some of my classmates have gone abroad. They would go abroad for a couple of weeks and do a lot of surgical work, fix a lot of teeth or uh, glasses, vision, or do a lot of orthopedic work for 2 or 3 weeks, and then they would come back home. Um, Again, I guess that's necessary and it's helpful to a degree, but I think that actually helping, again, as a family physician, I look at helping the people there in all their areas. And when we go there to teach the young people how to become medics, we do not ignore the fact that there are 50 orphans living there in scattered homes because there's no place to keep them. We looked at that as a problem of the community, and then did eventually develop an orphanage for them to try to help them. So these young children now have grown up, because it's 15, 20 years since we've had that orphanage, and they've grown up, and I think in much better atmosphere than if they'd have been in all the various separate homes which could not provide the attention, the care, the food, etc. So I think looking at the whole community is important, because that's what allows them to perhaps to pick themselves up. but that's only my opinion as the way family, as a family physician, what I like to do, what I think is necessary to do to help people in the world.